Fortunately for Guam, we're where America's day begins. And for the 15,000 Guam households representing over 43,000 residents, Supplemental Nutrition Assistance Program, better known as food stamps, benefits were loaded just hours before the federal government shut down. That's roughly $9.5 million in monthly benefits, or $115 million annually the island receives from the 100% federally funded program. According to Department of Public Health and Social Services Director James Gillen, SNAP, or food stamps, is just one of 60 fully or partially federally funded programs that may be affected by Tuesday's shutdown.
Some of the messages that we've been getting from the federal government have been kind of mixed. We weren't sure about what's going to happen, and some of it, the picture still isn't clear, but the ones we were really concerned about were the food stamp program, Women's, Infants, and Children's program, and Medicaid and Medicare.
While October food stamp benefits have been secured, looking ahead, Gillen is hoping to see action at the nation's capital sooner rather than later.
So overall, unless there's some unpleasant surprises, we don't see anything that puts us in a difficult position until November.
SNAP administration, on the other hand, will only have funding for the next 6 months. Similarly, the WIC program, food coupons, as well as its administration, only have funds for the next 3 to 4 weeks. In a program-specific draft to be sent to the governor, it's easy to see some programs are in the clear, as their grants have already been awarded, but others aren't so lucky.
Where we may have some difficulties with our community health centers, because some of the funding, there's about $1.4 million is available for staffing for about 25 people. We have some program income, which is what we as a community health center, we're supposed to charge for services. So whatever we collect is called program income. We can use that to get us through probably another month also. And we're hoping by that time that the Congress would have acted like adults.
If there's no funding for staff, ranging from physicians to registered nurses and support staff, the island's community health centers will have to reduce the number of patients receiving primary health care and preventative services, as well as decrease medical visits. This could leave an estimated 3,000 patients without health care and possibly increase the traffic at the Guam Memorial Hospital emergency room. Meanwhile, Gillen reports Medicaid, which is matched 55% by the federal government, has enough funds to last until the end of the year. Other supportive services such as the adult daycare, case management, in-home services, legal assistance services, and transportation services may be funded by their local match until June of next year, in addition to senior center operations. Reporting for Guam's News Network, I'm Crystal Paco.